out. So thanks everybody for coming out today. I know that it's a full day affair, and we do appreciate everyone, right from our stakeholders and our injured workers who've come. And we're celebrating 30 years. I recall 5 years ago standing at the International Plaza in Toronto celebrating 25, and we can hardly believe it. We had over 300 people there, and we've made it to 30. And I have to tell you that it hasn't been without struggles. The last 5 years has been a challenge to get through the new governmental change, the new legislative changes, and also the new funding changes when they've been so restricted by different governments. We've weathered the storm. We've weathered the storm in a way that our uniqueness as OCAL and the services and the tools that we have that we can provide to the public, I think have resonated. And that's what keeps us going, is our customer base, our client base, who come to us and say, we have a problem, we need your help. And then we're in turn able to take our talents with all of our disciplined staff, whether it's our hygienists, our nurses, our doctors, our ergos, it doesn't matter who, right down to, and right up, like from CSCs to the CEO. We're able to offer these products in a way that you put them in your hands and you're able to take them away. And what we're looking at now, like I remember the struggle we had when we had to get the Thunder Bay Clinic online. The Thunder Bay Clinic took quite a bit of fight to make it a permanent clinic. But in 2010, as we were heading into a year where a chair of the WSIB was leaving that was labor friendly, and into a government that we were unsure of, we were able to secure a clinic. Now, it's not a full clinic, but it's still a permanent clinic, and we were able to secure that. In 2016, those who don't know, we successfully, in a government of the day that was not really handing out money in a generous way, saw the need in Eastern Ontario, and because of, again, I believe our uniqueness and the services we were able to provide, we were able to secure another clinic in Ottawa for our Eastern Ontario folks. So to get that kind of stuff happening in a time of austerity, we feel was a significant feat. Now, we're in another situation where our strategic plan that is coming to an end in 2020, we have to start looking forward. And part of what we've been doing to celebrate the 30 years in each of our clinics with the open houses and these knowledge activism or motivation sessions is to try to say, okay, well, what do you need? What do we feel as the leaders of the organization feel you as the public need, and as our staff and the resources? So as board, we're trying to find a plan that's going to secure our future going outwards, whether it's X number of years, 3, 5, 10, 20. Obviously, we're not going to go that far. But we felt that with this government, we have to be a little more short-term and look at some achievables that we can make. So what we want to do is thank all of you, and especially the staff. And I want to give a real good shout out to the staff, because you heard it in Alex's presentation. I want to thank all of the pioneers, we called them this morning, who started this movement in Hamilton and made it grow. And we're now 7 clinics strong. Who knows, we may be 8 clinics strong in the coming years, because we're relevant, we're needed, and we're going to meet those needs. And we're going to fight the battles, we're going to fight through the red tape, the bureaucracy, and hopefully we can secure the funding to maintain our existence as we are now and even grow from there. So what we wanted to do is just give you a brief outline of what is going to board on December the 3rd at our meeting. We've done an environmental scan. We've looked backwards, retrospectively, to say what's good, what's bad, what does the horizon look like, what's the climate of the day look like, whether it's internal or external. What are the forces that are of evil that are trying to penetrate us, that are trying to divide us and destroy us. So what we're trying to do now is look forward to say, what's a reasonable plan that will still keep us viable, that will still make us worthwhile, but yet bring us to that next step and make us even better. So hopefully what we're going to show you in the next 5 minutes is that indeed.
Yeah, and I just want to echo, I mean, 30 is an impressive number, and it's a time to be reflective, and it was, you know, to really understand and appreciate that original 1005 a group, the community, everybody that's here that's part of the community, and to David's point of acknowledging staff, current staff, and as well as a number of past staff that have gone through Hamilton. So I was just going to frame up, I have a couple of notes here, and it was just, this is an interesting system time that maybe it's change of government, et cetera, but there were a number of reviews that were happening. So the WCB went through one in the Octazes area, and they said, you're doing a terrible job on surveillance, on science in terms of what's out there, and on dealing with stakeholders. And you know, as Sylvia and others mentioned, there's a number of clusters that OCAL is currently working on, and those roles of you know, using McIntyre powder as the example, and looking at the science and surveilling large groups of workers, and then dealing with stakeholders are things I think that OCAL very much in a strong position to go and to carry forward. There's a Metro inquest that Ron Kluski had noted that's happening this week. The last several months, we've been hearing about the Auditor General who's going to do a report. It's actually due the first week of December. Everybody's been sworn to secrecy, but little things come out, and it's, you know, keep up the great work on Octazes, and Val's nodding, but she's also taking our lead on the Octazes working group for the province. OCAL volunteered and we're lobbying for a few years to take that role on. And so it's actually in the last 3 years, it's been the most significant system in terms of putting resources together and getting a website and moving that forward. Paul Demers also was looking at Octazes, and his report is be coming out in December. And then I think one of the most significant events that I can recall in all the time that David has been with us, he got us an audience in front of the guy who's doing the WSIB review, and Dave Wilken, our Chief Operating Officer, Dave and myself met for, I think it was supposed to be a short meeting, ended up being a couple of 2.5 hours. And we were just saying, you know, and I've been at OCAL 20 years, I do not recall, Val and I and others, we worked on a presentation of just all of the clusters, the 3 that we're working on significantly, but just all of the ones that are just, been mentioning them in various reports, but they're just, it's at the point in time where the workplaces are closing, and it's just, it's a point in time where OCAL really needs significant consideration. It really needs that audience that was being mentioned by Leo and others. It's one of those really sentinel moments, I think, for OCAL. And so David really developed a relationship with Sean, and Sean was, you know what, that seems like a reasonable request. It's a smaller amount, you know, maybe $5 million or so a year. Yeah, I'll include it in the report. So we'll know in a few weeks. And if that happens, then we're in great shape. If not, then, you know, then there'll be maybe some more political considerations for, you know, an emission like that, and why workers who have, you know, the precarity of the work has put them in this situation where they've been, you know, sick and dying. You know, they really need some resources to go into, get some medical scientific evidence to help them out. So those were the backgrounders, and they're coming out, you know, pretty much next week, or next month rather, in December. And that meant that the system has delayed their strategic plan, and that's the prevention system. And so OCAL has been waiting for that, but we've developed, I think, just the framework. And I will say there was some mention of Greg Sorbera, and his mandate way back when is very much what OCAL has continued to have done, and all the time that OCAL has been around. There's still a massive need for all of the things that we go and do. And, oh, did you? Yeah, you read it through, and it just resonates today as much as, you know, probably the time that it was written. So, I mean, our strategy that we're going to be presenting is very much a continuation of the great work that OCAL does, and just framing it in a way going forward. So we start, and I don't know how that waved, it moved forward. You, I thought the paper, I thought there was some magic.
That's how it worked.
So that first thing was, and it's saying there, it's 2020, you know, so it's March 31st at the end of the 5-year period is ending. So back in February, the board has been working on this for a number of meetings. David mentioned doing a scan, and so we set up a framework, and we'll see them there, vision, mission, core principles, values, strategic directions, and we'll go into a little bit of detail on each of these component parts. Priorities and lens, oh, it's not quite done.
Oh, sorry.
Approach and services and performance indicators.
Yeah.
Okay, so one more. So then there was also the consideration of, you know, previously been these 5-year plans. Is that really the way that we want to go? massive changes in technology in our environment, election changes, and so some real consideration of potentially doing two plans. And the board, after a lot of deliberations, thinking about things, thought, that actually seems like a reasonable approach. So there were some ideas of, why that would make sense. So I think one more. And so then David led the board out in a voting exercise, and what was the end result, the upshot was that there was a strategic horizon plan, and that's very much that labor-based, aspirational vision plan, and it was agreed that it would be 7 years. Not to say that the shorter one isn't, but there's an acknowledgement of and so that would be one that would just be internal to OCAL. And the thinking would be that, somebody has an idea and they would tweak something anywhere in the organization, it would go through the executive committee and then go to the board, and it would be sort of a constant update. And that would be anybody new to the organization, that would be the driving overall document of the organization. And then there's the public-facing one that will be the 3-year time horizon. So that's the time that we went through with respect to that. There were two other things that we just presented to the board, and it was very much just things that we want to confirm. Number one, OCAL provides its services in areas that really aren't the revenue generation areas. Those are the areas that some of the other health and safety partners very much zero in on, but things of occupational disease and vulnerable workers, those aren't the areas that you're looking to go in to make money on, but those are the areas of the greatest need in the system, and those are the areas that we go and prioritize, and that was very much confirmed. And then the other one was just, there's this health and safety. We're very much in the health world and in that. We're unique. We're the only ones that do that. And it was an affirmation that continue. That's the space that we want to be continuing in. And you want to do a couple, just going back and forth a little bit.
Yeah, so the vision we did tweak last year a tiny bit, because we always want to make sure that we go back and make sure that we're meeting our mandate and looking ahead in the proper way. So you'll see that we haven't changed anything. We're still looking at the detection and prevention and the elimination of the occupational disease, injuries, and illnesses. And one of the reasons why we're still in the game of the projects, the rubber workers, the GE, the McIntyre, the Ventroplastics, the rubber workers, is because we have special funding over and above our core funding that we're able to dedicate specific resources to that and to those projects. But realizing that if the funding ends, our ability to keep up that 100% focus is going to end as well. And we don't want to see that happen, because it is part of our vision. It is still part of our mandate. And that's why we're trying to get permanent funding for these types of projects to make them part of our core services. That's going to be our fight. That is going to be our ask. And if we aren't successful, then it's not for lack of trying. We are still going to do the stuff called promotion of in the highest degree of the physical and mental and social well-being for all workers. You've heard today, and you've seen some of the presentations on some of the areas that we're doing the deep dive in, like mental health, right? And the new ones that are coming out are the nanotechnology and the effects on the body. So, next slide. The mission then, I won't read all through it because the mission hasn't really changed, but when you see the words like to support their capacity to address occupational hazards, as long as we have the capacity, aka the money, to be able to meet all of the needs, even if we don't, we're going to fight for it so that we can, because it's within our mandate. We're not going to stop trying. We're not going to stop pushing the envelope, and we're not going to stop trying to meet the goal that has been set for us, and by the board. But remember, the board is made up of many stakeholders from all the different unions, community agencies, etc. So we're a wide range of people that make up the board. And this is what the board has decided that is going to go forward and continue to be our mandate as slightly amended.
So on this one, this is very much developed by the board, and I'm not going to read it, but rejecting behavior-based safety, remain labor governed. They're just the principles, core values, and so this would be maybe something that would be in the 7-year document. We go maybe 2 more slides down. So essentially, the only other consideration there, and it was something that was in the scan that was resonating, was just the importance of the environment and just having some sort of a principle like that. On the next. Do you want to do this, or do you want to? I mean, it's very much defining, who OCAL is. At this point in time, this was just a presentation slide to the board. So clearly, it'll be for over 30 years, and we have to do some tweaking in some words. But we're just trying to frame up where we're at a point in time because we're still waiting for the system to finish off before we can then go and do the finalization to ours. But I mean, all the things that we've been saying really today are resonating, I think, in the principles and the uniqueness of OCAL. So next. So the strategic directions, and then we, this was something that we refined a little bit, and part of it was certainly in 15. And interestingly, when reviewing where some of the other HSAs are, they've all now included information technology in their strategic plans going forward. And that was something that was really resonating. The board captured it, the plan, so it would have been, 14 for the 15 plan. And so very much was an emphasis. And I think that sort of was, all right. Now I remember having a conversation with John and CCOHS. Actually, our former CEO, Anthony Pizzino, was saying, hey, there's some capacity at CCOHS. And I think John was waiting in the wings and leapt at it. And I think from there, it just, seemed to have snowballed. And it really defines, I think, a lot of the talk today in terms of the tool and being able to leverage that and put that in the hands of the workers. So, sorry, I don't know if I finished that one. Yeah, anyway, so we're mapping, so we're saying that the information technology very much within our organization, and then we didn't have a growth goal, which is going to be for 3 years, just based on where the government was at. But the other ones will remain, and growth we'd still be trying to achieve these things, and even in potential other government sources of funding, but not necessarily will it be something that would be a core strategic direction. So continuing, I'm seeing the timer click away there. Yeah. So we've got our main focus, and this really maps very much where the prevention system seems to be going. Where there's they've got 3 things. They've got occupational disease, workplace mental health. And they have something called high hazards. We just have something called occupational health issues. Again, making sure that we zero in on the health side of health and safety. And then those are our priorities, and then with a different lens in the green boxes that go around it for next. And so David and I were just looking at this one. It might be an opportunity on the bottom there, that knowledge transfer one, to maybe tweak language, because this is very much, again, a placeholder. But the idea of somebody presents maybe to clinic, and then the opportunity to say, oh, it might be happening in some other workplaces, and then there's the prevention element, and then maybe I need to do some research or provide some sort of a tool, and then you're making people aware of it. So those are the things that are on our website and the things that we're going to continue as it relates to our approach. Next, we actually in something called the designation standards actually have to have something where the board is assessing where we're at. So we just refined this a little bit. It's still within this, the textbook way that the scorecard gets set up, but it also means that we went into a little bit more detail. But then at the board level, we actually went into really specific examples of what we'd want to go in and try to report on and achieve during the time period. I think that's probably, it might be just the About Us, yeah. So then there's just our generic About Us placeholder, and then the locations. And so that's essentially where we're at currently for strategic plan.
So you can see that it's an evolving plan. It will be adopted by board and implemented beginning December for our 2020 and beyond. We're always open to suggestions. We're always open to new ideas. We're always going to be willing, whether it's in our strategic plan or not, to make it part of our operational plan to do different things. But at least for, as Michael mentioned, the out-facing, when this kind of a document, the strategic plan, goes out to those through the web and through our interactions, and they see what our plan is. They'll see that it's current, they'll see that it's according to the mandate that's been given to us by the government, and it falls within what we have always done, but we're always improving and we're always venturing into new and different territories and new waters. But it's because we're evolving as a society, and there's the different needs that need to be met. And again, going back to what Michael and I talked about at the very beginning, because of OCAL's uniqueness, we have shown ourselves to be able to meet those needs. And we're going to continue to do that to the best of our ability.
Yeah, we're either leading or co-leading 2 of those main pillars, and we're feeling pretty confident. I think that the reviews will show us in really good light. So we'll have a little bit of a clearer path forward in maybe a month or so. But I think we're pretty proud of all the accomplishments, and I think that was pretty much what was crystallized today in terms of some of the successes and the emphasis that OCAL has had on workers. That was a clap. Let's go eat the cake.
Yeah, well, great. Thank you, you guys, for sharing where we're going to go, but always keeping nimble so we can take advantage of every opportunity that arises. We are opportunistic. I did want to actually bring the Hamilton staff up here because I should have introduced them all at the beginning, because this is actually about the whole clinic. So do you guys want to come up? We're missing a few people, but John, you've met. Yeah, and then we'll go stand by the cake. But I want to bring them up because then they'll be on the video too. Unfortunately, Michelle and Eduardo couldn't be here today, and they are very. Michelle's our occupational health nurse and involved in the clinical work as well as the migrant farm worker work. And Eduardo is the community and outreach program coordinator. And he's involved in the migrant farm worker program, but as well as a lot of other work with vulnerable communities like newcomers. So I don't know, we should have brought some, but this is Masood Ahmed, who's one of our hygienists. And I meant to look up last night how long everyone's been here. So Masood, tell us how long you've been here.
Well, in Hamilton, I came here in 2015, but before that I was in Sudbury since 2008. So altogether 11 years.
Yeah.
And before that in Windsor?
In Windsor for about 6 months in Windsor.
So almost 12 years then.
Yep.
Great. And this is Dr. Daryl Stevenson, who's our ergonomist, who's been here over a year.
A year and 2 months.
Yeah, great. And Marilyn, who's our client service coordinator and the person who answers the phone and people talk to first many of the times that they contact the Hamilton Clinic. And Marilyn, it's what, 20-some years, 22?
And hopefully do a little more than just answer.
Oh, I know that. I'm sorry. Yes, that's right. I just meant that's the voice you hear. But yeah, lots of
Right.
coordination of things like this and the project. The rubber worker project, and it's making order from chaos. That's what we rely on our client service coordinators to do for us. So, and John, who is 30 and a half years now, I guess, and a hygienist. I assume everybody knows that, but I guess we didn't actually say that. And Murray,
I'm the other hygienist.
yeah, Murray Lawrence is a hygienist.
Been here 27 years.
Wow.
Yeah.
I'm still learning from the boss.
He was in the early clinics. He was involved with Ted.
Yeah.
And at St. Mike's you worked, so.
Well, there's some other places I'll deny.
At McMaster.
That's true.
Yeah.
Add it all up, he's got more years.
Yeah, he's a great researcher.
What he's trying to say is I'm older than you. Which I'll also deny.
We have a lot of years to get all of us together.
Yeah.
Now, have you got 30 out in your contract yet? No?
We need a negotiator. Are you available?
Okay. So now I guess let's go have a picture by the cake and then we'll cut it and serve it so everybody can eat some. But did everyone see how great a job they did on the cake? So. Marilyn.
Yes.
Come here, please. Need picture.
That is a great cow.
Yeah,
There we go.
All the way on the. Michael, you should go in there too.
Leo want me to
Lead Cheryl and
Here. Daryl, we can still see over me.
Why is everyone holding?
And then we'll get everybody. We might as well take everybody.